Hi, this is Dr. Tanya Kormeili. I'm a board-certified dermatologist in Santa Monica, and today we're going to talk about menopause and hair. As if it's not bad enough that we have all this emotional stuff coming up during perimenopause and menopause, losing our hair and having hair places we don't want seems to be just the last straw. Let's talk about why that happens. Menopause is defined as not having a period for consecutive 12 months. So for a year, not having a period puts us in menopause. We don't wake up in menopause. About a decade before that, we start the process of perimenopause. Gently, your estrogen levels and progesterone levels fall, but the male hormones like testosterone and the androgens fall still much less. There is a difference between the ratio of estrogen to androgens, the male hormones, right, female to male hormones, when you're 20 than when you're 60. This decrease in the female hormones puts our hair from the growth phase, which is called anagen, into non-growth phases. Building more hair, keeping it from shedding becomes very challenging. Now that the female hormones are lower, the male hormones can have more of a say in the body. Increased androgen levels can make you have hairs on your chinny chin chin, or you start noticing acne on the jawline. Hair distribution on your body is also different. That is very much expected. Without the wonderful estrogen levels, like we start getting what's called a female pattern hair loss, which kind of mimics the male pattern hair loss. It just that happens further in life because we have that estrogen to protect us from the male androgen levels for far longer than men do. What does that mean for you, and what can you do to make sure you keep as much of your hair as possible? As we talked about, the male hormone, particularly DHT, really works on the front of the scalp and all the way in the crown of the scalp, and this whole area is at the highest risk for loss. It would stand to reason that if you block some of that male hormone, at least topically on your scalp, you can protect some of that hair. There's a medication called minoxidil, right? And in a topical format, it comes as Rogaine, commercially available. But minoxidil generically is available over the counter. And if you want stronger minoxidil, you can ask your dermatologist to write you for a prescription, and it can be made for you. Some people choose to take minoxidil orally, but caution. When you take minoxidil orally, it works all over your body. It's not just on your scalp. You may get hairs in places that you did not want to have hair, like all over your face, hands and feet. Areas that you normally were not hairy can also turn hairy. So you have to take minoxidil orally with caution. It's also a blood pressure medicine. So if you run with lower blood pressure, you have to be really careful. And if you're the type of person who swells a lot, minoxidil can make you dilate more in your blood vessels, so you may be more swollen. So those are things to worry about. There's also the oral medication that we know men to have been taking for a long time, finasteride or Propecia. Some people feel comfortable putting women on that because it blocks some of the male hormones. Other people feel that it's better to put women on spironolactone or aldactone because it blocks the androgen on a different site and also lowers that, especially if you have high testosterone or DHEA level at your age. Now, DHEA is a really good hormone, so you don't want to get rid of it completely. We talked about how there's a ratio between male to female hormones. So the other option would be to increase your estrogen levels. Now that can be done with a hormone patch of just getting, like, say, estradiol, or you can get a balanced cream that has the different kinds of estrogens and different concentrations that you can apply topically. Balancing the estrogen to the androgen level will help protect your hair. Now, how can you nourish stem cells of your hair? How can you get your hair that robust growth factors to be able to grow more? Well, the answer is your body already knows how to heal. In our blood, we have stem cells, growth factors, and all sorts of chemicals that signal growth and healing, help us regenerate ourselves. By a process called PRP, we can take your blood and be able to take all those good chemical signals and be able to inject it back into the scalp to nourish your own stem cells, to nourish your own hair to be able to grow more. So that's another thing you can do. There are lasers you can do, there are low-level energy lights you can do, there are things you can do to kind of promote the growth of the hair, the part of the hair that's inside your scalp that causes your hair shaft to grow. Now, what do we do about the shaft? Unfortunately, with this change in hormones, the shaft itself also gets brittle, thinner. You may notice that your hair frizzes more, it kinks more, it's not the same luster as it was before. That is also the result of hormones. So stylistically, using excessive hair, using very harsh sulfates, or using chemicals that dry out your hair shaft, make it so that your hairstyle doesn't look as good. So be very careful in choosing products that really help with the shaft health as well and don't dry out your scalp. That helps with the hair here. But what do we do with all the hair that we don't want elsewhere? While your hair is dark, you can get rid of it permanently with laser hair removal. The minute the hair turns white, you can hit it with the highest level of energy. It just goes whoosh and looks right back at you and says, try again. It just won't go away. And the reason for that is we need pigment to be able to kill a hair permanently. Your hair has to be in its growth cycle for it to die permanently. You need more than one laser hair removal treatment to be able to get rid of it. But if you are convinced that you are going to be bothered with having hair on your chin, upper lip, hands, feet, wherever it is that you don't want this excessive hair, get rid of it before it turns white, because once it turns white, the only thing you can do is electrolysis, and that's very slow and cumbersome. Now, here is a little bit of levity. It's not just hair on your scalp that gets a little bit lighter. You may notice that you don't have to shave your legs and underarms as much when you get older, and that's because hair overall is getting weaker. So that's probably the best side effect of this whole menopause situation, is that you won't have to shave your legs as robustly. Any hair you don't want, get rid of it while it's dark, and protect the hair you have on top using all the different modalities I talked to you about. And make sure you have healthy body habits like nutrition, sleep, not a lot of excessive alcohol, and not drugs, not anything that depletes your body from overall nutrition, rest, and causes more inflammation and damage to your body. Here's to having pretty hair.